It depends on the day and it depends on the week. And I'm sure that's true for pediatricians across the country. If we're doing our hospital week, I'm on my hospital week right now. I'm at the hospital for pretty long and busy days, seeing our admitted babies in the NICU and admitted children on the ward. And we'll do that for 7 days straight. And then we get a bit of a gap where we can run our office practice. I work in the office about 3 days a week. I have 1 day for administrative work for some other jobs that I do to catch up on all the charting and what used to be called paperwork. That's what a typical day is like for me, usually.
I get up early, and by 7:30, 8 o'clock, I'm on my way to the office. I do a lot of paperwork in the morning before starting, seeing everything and anything that comes through the door. General pediatrics could be anything. I also did some special training in pediatric gastroenterology. So that's also a little part of what I do, but it's mainly the nutrition part. It doesn't feel like working. I'm enjoying it.
Yeah, so I mean, in Yellowknife, I do a little bit of everything. I do the inpatient stuff, I do the clinic stuff, I'm on call, resuscitations. So, that's a typical day that most general pediatricians have in a smaller rural regional center. When I'm in Edmonton, it's standard clinical teaching unit stuff where I go to work. So that's much more traditional tertiary care. And then there's other days where I start the day off at like 7:30 and I start driving, and I drive for 2 hours to Saddle Lake Reserve. I do my clinic. I'm heavily involved with this Canadian Pediatric Society, so that gives me a break from regular clinical work. So yeah, every day is a little different. Every day the schedule is different. I'm never bored. I get tired sometimes, but I never get bored.
There's no typical day. It depends. Is it a clinic day or a hospital day? We share the clinic space amongst our group, which makes it great for running things by each other. We're all in one space, so you can, ask what would you do, which is great, especially when starting out.
What's really, I think, nice about our practice here is there is a lot of diversity in terms of what we do. And so in a typical week, for me, I might also have a diabetes clinic. I might also do a clinic at the local Indigenous health clinic. And then I also may spend some time at our local child abuse clinic. And so I work there and sort of care for kids that have had suspected child maltreatment, but also trying to work on some kind of advocacy and support for those communities as well.
Hospital days, answering phone calls, going down to emerge, being called to deliveries, rounding on your patients, doing some one-on-one teaching with students. It's just this wonderful collaborative model that comes together both in the community and outpatient clinic and also in the inpatient wards. It's just great.
I love the idea that in a community like ours, we can become dive a little more deeply and become a little more expert in an area that we're interested in. So I really like that. I like that about my practice. I love the diversity in the hospital. I think it's super interesting medicine. We see lots of fascinating cases. We, I think, help people through some of the most difficult times of their life with really sick kids. And I guess I also like the continuity of having a community practice. I think that's fantastic. I have kids, I've been in practice a while now, and I've had kids that I met in kindergarten who are graduating high school now. And I just think that's a really cool opportunity as a specialist, as a consultant, to have that longitudinal connection.
Eventually, like right now, for example, I have about 30 second generation patients. So that's a pleasure, when they come to the office, they tell their kids, he was my doctor. The other area, it's the ability to be able to help kids and navigate the system, which sometimes is very difficult. So I think that I get a lot of pleasure in the advocacy.
What keeps me going, what keeps me humble in pediatrics are the kids. The kids kind of are the light to my candle when it comes to work.
In a typical day, we can, see some really interesting, developmental and mental health peds, but also some really interesting medical problems. And then you might get called stat to a code pink where a woman is in trouble and you're there to help when the baby comes out. And meanwhile, the other part that I really like about it, in all those areas, we work really closely with medical students and residents. And one of my roles is as being one of the kind of academic leads with the medical school and the residency programs. So I really love the idea that here I can do a bit of everything.
I love the medicine. Working in a smaller center, I feel like I'm making a contribution to some of these patients' lives. The other aspect of general pediatrics I really like is the community I work in. So whether it's in Edmonton or whether it's here, high level, especially here, I feel like I'm part of the community. I know people here. You know, that is a special part of doing gen peds in a smaller center, because you become part of the community.
Well, if the children are happy and the parents are happy, I'm happy. I don't feel like working. I'm enjoying it most of the time. The problem is when I have to give needles. I don't like that. I don't like that. That's probably the part of my work that I don't enjoy very much. But everything else is fine. I talk to the children. I play with the children. I interact with them, with the parents. I think that's probably the part of my success.